Question 1. A radiographer is preparing for a CT abdomen and pelvis scan on a patient with a known allergy to iodine-based contrast media. Which of the following is the most appropriate course of action? A. Administer the contrast media as planned but monitor the patient closely for an allergic reaction. B. Cancel the CT scan and suggest an alternative imaging modality that does not require contrast. C. Pre-medicate the patient with corticosteroids and antihistamines prior to contrast administration. D. Proceed with a non-contrast CT abdomen and pelvis only. Answer: C. Pre-medicate the patient with corticosteroids and antihistamines prior to contrast administration. This question tests your knowledge of managing patient allergies to contrast media, a critical aspect of patient safety in medical imaging. The keyword known allergy to iodine-based contrast highlights the need for a specific protocol, rather than ignoring the allergy or simply canceling the exam if it's clinically indicated. For patients with a history of moderate to severe allergic reactions to contrast, pre-medication with corticosteroids and antihistamines is the standard and safest approach to minimize the risk of a reaction. For example, a patient might receive prednisone several hours before the exam and diphenhydramine just prior to contrast administration. This strategy allows the necessary diagnostic information to be obtained while protecting the patient. Here's an easy way to remember. A known allergy usually means pre-medication is the safest route when contrast is still required. Question 2. When performing a lateral projection of the cervical spine, which of the following is the primary reason for placing the patient's shoulders as far inferiorly as possible? A. To ensure the entire cervical spine is included on the image. B. To reduce magnification of the cervical vertebrae. C. To increase patient comfort during the exposure. D. To improve visualization of the atlanto-occipital joint. Answer: A. To ensure the entire cervical spine is included on the image. This question focuses on optimal patient positioning for a lateral cervical spine projection, emphasizing the importance of comprehensive anatomical coverage. The keyword primary reason directs you to the most crucial outcome of the positioning technique. Depressing the shoulders inferiorly helps to superimpose them away from the lower cervical vertebrae, C6, C7 and C7 T1 junction, preventing their obscuration and ensuring the entire cervical spine, from C1 to T1, is visible on the radiograph. Without this maneuver, the shoulders often overlap the inferior-most cervical segments, making assessment difficult or impossible. For example, having the patient hold weights or pull their arms down firmly helps achieve this crucial shoulder depression. Remember, clear visualization of all cervical vertebrae is paramount for accurate diagnosis. Question 3. A technologist observes a starburst artifact radiating from a metallic hip prosthesis on a CT image. What is the most effective method to mitigate this artifact during image acquisition or post-processing? A. Increase the kilovoltage peak, kVp. B. Reduce the field of view, FOV. C. Apply metal artifact reduction, MAR, algorithms. D. Decrease the slice thickness. Answer: C. Apply metal artifact reduction, MAR, algorithms. This question tests your understanding of common CT artifacts and specific techniques for their mitigation, which is essential for producing diagnostic quality images. The keyword starburst artifact radiating from a metallic hip prosthesis clearly points to a metal artifact, which results from beam hardening and photon starvation as the X-ray beam passes through dense metal. Modern CT scanners are equipped with specialized metal artifact reduction, MAR, algorithms that can be applied during reconstruction or post-processing to reduce the streaking and starburst appearance caused by metallic implants. For instance, These algorithms work by selectively reprojecting data or using iterative reconstruction techniques to correct for the severe attenuation differences. Remember, MAR algorithms are specifically designed to address artifacts from high-density materials. Question 4. According to ALARA principles, which of the following practices is the most effective in reducing occupational dose during fluoroscopy? A. Standing at the control panel during the entire procedure. B. Using a lead apron with 0.25 mm lead equivalency. C. Maintaining maximum distance from the X-ray source and patient. D. Activating the last image hold feature after each fluoroscopic run. Answer: C. Maintaining maximum distance from the X-ray source and patient. This question assesses your practical application of the ALARA principle, as low as reasonably achievable, in a fluoroscopic environment, focusing on occupational radiation safety. The phrase, most effective in reducing occupational dose, highlights the need to identify the primary method among the choices. Distance is the most effective radiation protection cardinal principle because radiation intensity decreases rapidly with increasing distance from the source, following the inverse square law. For example, doubling your distance from the source reduces your exposure to 1/4 of the original dose. While lead aprons offer protection and last image hold reduces fluoroscopy time, maximizing distance provides a significantly greater and more immediate reduction in dose. Always remember, distance is your best friend for radiation protection. Question 5. A patient undergoing an MRI scan suddenly develops symptoms of an acute allergic reaction to the gadolinium-based contrast agent. What is the radiographer's immediate priority? A. Administer diphenhydramine intravenously. B. Notify the radiologist and prepare for code blue. C. Stop the contrast infusion and call for medical assistance. D. Monitor vital signs every 5 minutes. Answer: C. Stop the contrast infusion and call for medical assistance. This question probes your immediate response to a life-threatening situation during an MRI, specifically an allergic reaction to contrast, testing your critical thinking in patient safety. The keyword immediate priority emphasizes the urgency of the situation and the first crucial step. The very first action should always be to stop the infusion of the substance causing the reaction to prevent further exposure, then immediately activate the emergency response system by calling for medical assistance. While monitoring vital signs is important and informing the radiologist is necessary, stopping the agent and getting help are the initial, most time-sensitive steps to manage the reaction effectively. For instance, if a patient develops hives and difficulty breathing, stopping the contrast immediately can prevent the reaction from worsening. Remember, stop the agent, then get help. Question 6. What anatomical landmark is used to accurately localize the fundus of the stomach for a standard erect upper gastrointestinal (UGI) series? A. The xiphoid process. B. The iliac crest. C. The level of the sternal angle. D. The dome of the diaphragm. Answer: D. The dome of the diaphragm. This question tests your knowledge of anatomical localization for specific radiographic procedures, which is fundamental to accurate patient positioning and image acquisition. The keyword fundus of the stomach and erect UGI series requires recalling the normal anatomical position of the stomach in an upright patient. In an erect position, the gas-filled fundus of the stomach typically sits high, just beneath the left hemidiaphragm. Therefore, the dome of the diaphragm is the most reliable external landmark for this region. Using the dome of the diaphragm ensures that the entire fundus, often distended with air, is included and optimally visualized. For example, centering the image receptor just below the left hemidiaphragm will generally include the fundus. Always remember the relationship between internal structures and external palpable landmarks. Question 7. A radiograph of the elbow shows significant foreshortening of the olecranon process. Which of the following positioning errors is the most likely cause? A. Excessive flexion of the elbow. B. Insufficient flexion of the elbow. C. Improper alignment of the central ray. D. Medial rotation of the humerus. Answer B. Insufficient flexion of the elbow. This question assesses your understanding of how patient positioning affects image geometry and appearance, specifically regarding foreshortening in elbow radiography. The keyword foreshortening of the olecranon process immediately indicates that the long axis of the structure is not parallel to the image receptor, or the central ray is not perpendicular to it. When performing an AP elbow projection, if the elbow is insufficiently flexed, the olecranon process will be angled relative to the image receptor, leading to its foreshortened appearance on the radiograph. For example, if the elbow is extended more than 90 degrees for an AP projection, the olecranon will project shorter than its actual length. Ensuring the correct degree of flexion and central ray alignment is crucial for accurate representation. Remember, foreshortening happens when the object is not parallel to the image receptor. Question 8. In digital radiography, what impact does increasing the detector element, DL, size have on spatial resolution? A. Increases spatial resolution. B. Decreases spatial resolution. C. Has no effect on spatial resolution. D. Improves contrast resolution but not spatial resolution. Answer B. Decreases spatial resolution. This question delves into the technical aspects of digital imaging detectors, specifically the relationship between detector element size and image quality, a key concept for understanding digital radiography. The question focuses on the impact of increasing DL size on spatial resolution. Spatial resolution, which is the ability to distinguish small objects or details, is inversely related to detector element size. A larger DL size means fewer pixels per unit area, resulting in less detailed information being captured. For example, think of a photograph. If you have fewer, larger pixels, the image will appear blockier and less sharp than one with many small pixels. Therefore, increasing the DL size leads to a decrease in spatial resolution. Always remember that smaller DLs contribute to higher spatial resolution. Question 9. What is the primary purpose of beam filtration in diagnostic radiography? A. To increase the overall intensity of the X-ray beam. B. To remove low-energy, non-diagnostic photons from the X-ray beam. C. To harden the X-ray beam, making it more penetrating. D. To reduce patient dose by absorbing all X-rays. Answer B. To remove low-energy, non-diagnostic photons from the X-ray beam. This question tests a fundamental concept in X-ray physics and radiation protection, the role of beam filtration. The keyword primary purpose directs you to the most important function of filtration. Filtration, typically aluminum, selectively absorbs the low-energy, soft X-ray photons that would otherwise be absorbed by the patient's superficial tissues without contributing to image formation. By removing these non-diagnostic photons, the average energy of the beam increases, hardening the beam, which then results in reduced patient skin dose and improved image quality by reducing scatter. For example, a 2.5 mm equivalent of aluminum filtration is typically required for diagnostic X-ray tubes operating above 70 kVp. Remember, filtration's main job is to protect the patient by removing unwanted radiation. Question 10. A patient presents for a barium enema, and during the procedure, experiences severe abdominal cramping and feels lightheaded. What is the most appropriate initial action? A. Immediately administer intravenous pain medication. B. Elevate the patient's legs and monitor vital signs. C. Quickly complete the examination before symptoms worsen. D. Discontinue the barium administration and offer reassurance. Answer: D. Discontinue the barium administration and offer reassurance. This question assesses your ability to respond appropriately to patient discomfort and potential adverse reactions during a diagnostic procedure, highlighting patient safety and care. The keywords severe abdominal cramping and lightheaded indicate a need for immediate intervention. The most appropriate initial action is to discontinue the administration of the agent, barium, that might be contributing to the discomfort and to provide reassurance to the patient, then assess the situation further. For example, stopping the barium helps prevent worsening distension or a potential vasovagal response from progressing. While elevating legs and monitoring vital signs are good follow-up steps, stopping the procedure and comforting the patient is the first priority. Remember, patient comfort and safety always come first. Pause and assess before proceeding. Question 11. Which of the following adjustments would result in the greatest reduction in patient radiation dose during a chest X-ray, assuming all other factors remain constant for diagnostic quality? A. Increasing kVp by 15% and having MOS. B. Decreasing SID by 10 cm. C. Using a faster image receptor system. D. Employing a smaller field of view. Answer: A. Increasing kVp by 15% and having MOS. This question tests your understanding of exposure factor manipulation and its impact on patient dose while maintaining image quality, a key concept in radiation protection and image optimization. The 15% rule states that increasing kVp by 15% while having the MOS will maintain the overall optical density, or image brightness in digital, but significantly reduce patient dose because higher kVp produces a more penetrating beam with less absorption in the patient. For example, if an initial exposure was 80 kVp and 10 MOS, increasing to 92 kVp, 80*1, 15, and reducing to 5 MOS would achieve similar image density with a lower patient dose. While other options can reduce dose, the 15% rule for kVp and MOS adjustment offers the greatest immediate reduction while preserving image quality. Remember this rule as a powerful tool for dose reduction. Question 12. During a mobile chest X-ray in the intensive care unit, ICU, what is the most critical infection control practice a radiographer must adhere to? A. Wearing a lead apron at all times. B. Cleaning the image receptor with an alcohol wipe. C. Practicing meticulous hand hygiene before and after patient contact. D. Disinfecting the X-ray machine after each use. Answer: C. Practicing meticulous hand hygiene before and after patient contact. This question focuses on essential infection control practices, particularly in a high-risk environment like the ICU, emphasizing patient and healthcare worker safety. The keyword "most critical" in the context of infection control immediately points to the most fundamental and universally effective measure. Meticulous hand hygiene, including hand washing or using alcohol-based hand rub, is the single most effective method to prevent the spread of healthcare-associated infections. For example, before touching the patient or imaging equipment, and after, a thorough hand wash reduces pathogen transmission. While lead aprons are for radiation protection and cleaning equipment is important, proper hand hygiene directly breaks the chain of infection. Always remember, clean hands save lives. Question 13. A patient is positioned for an AP projection of the ankle. To demonstrate the ankle mortise joint without superimposition, how should the foot be positioned? A. Dorsiflexed 90 degrees to the lower leg. B. Plantarflexed as much as possible. C. Internally rotated 15 to 20 degrees. D. Everted 15 to 20 degrees. Answer, C. Internally rotated 15 to 20 degrees. This question tests your knowledge of specific anatomical positioning required for optimal visualization of a particular joint, a common requirement in radiographic practice. The keyword ankle mortise joint without superimposition is a strong clue, as the mortise is formed by the tibia, fibula, and talus. For an AP projection of the ankle, the intermalleolar plane must be parallel to the image receptor to open the mortise joint, which typically requires internally rotating the foot and lower leg 15 to 20 degrees. For example, if the foot is not rotated, the distal fibula will superimpose a portion of the talus, obscuring the lateral aspect of the mortise joint space. Always remember that internal rotation is key to opening the ankle mortise on an AP view. Question 14. In computed radiography, CR, what happens to the latent image stored in the photostimulable phosphor, PSP, plate when exposed to the laser in the CR reader? A. The energy is converted directly into an analog electrical signal. B. The stored energy is released as blue-violet light. C. The phosphor crystals are physically rearranged to form the image. D. The plate is resensitized for immediate reuse. Answer, B. The stored energy is released as blue-violet light. This question delves into the fundamental process of image extraction in computed radiography, a core concept for understanding digital imaging systems. The keywords latent image and exposed to laser in CR reader describe the specific step where the trapped electron energy is converted into a readable signal. When the PSP plate, containing the latent image of trapped electrons, is scanned by a red laser in the CR reader, these electrons are stimulated to return to their ground state, releasing their absorbed energy as a visible blue-violet light. This emitted light is then detected by a photomultiplier tube and converted into an electrical signal. For example, this light emission is proportional to the X-ray energy absorbed by the phosphor in that area. Always remember that the laser stimulates light emission, not direct electrical conversion. Question 15. A radiographer is reviewing an abdominal X-ray of an infant and notices that the exposure parameters were set for an adult. What image quality characteristic is most likely to be significantly affected? A. Spatial resolution will be too low. B. Image contrast will be excessively high. C. The image will appear severely underexposed. D. The image will be significantly overexposed. Answer, D. The image will be significantly overexposed. This question tests your understanding of appropriate exposure factors relative to patient size and their impact on image quality, a crucial aspect of pediatric radiography and dose optimization. The keywords abdominal X-ray of an infant and exposure parameters set for an adult indicate a massive mismatch in patient thickness and density. An infant requires significantly less radiation dose compared to an adult due to their smaller size and lower tissue density. Therefore, using adult exposure parameters on an infant will result in a radiograph that is severely overexposed, appearing much too dark with very little differentiation of structures. For example, using 70 kVp and 20 MOS for an infant's abdomen is vastly too high, where perhaps 50 kVp and 2 MOS would be appropriate. Remember that pediatric patients require substantially lower exposure settings. Question 16. What is the main advantage of using a high-frequency generator in X-ray production compared to a single-phase generator? A. Produces a more pulsating X-ray beam. B. Reduces patient motion artifact. C. Generates a more constant X-ray output. D. Requires less cooling for the X-ray tube. Answer, C. Generates a more constant X-ray output. This question explores the principles of X-ray generator types and their impact on X-ray beam quality, a fundamental concept in X-ray physics. The keyword main advantage specifically asks for the primary benefit of high-frequency generators. High-frequency generators produce a nearly constant potential voltage ripple, meaning the voltage applied to the X-ray tube fluctuates very little during the exposure. This results in a more constant and efficient X-ray output, leading to a higher average photon energy and greater X-ray quantity per MOS compared to single-phase or even three-phase generators. For example, this more consistent output translates to shorter exposure times and reduced patient dose while maintaining image quality. Remember, constant voltage equals constant X-ray production, which is more efficient. Question 17. During a fluoroscopic procedure, a technologist notices that the image intensifier's brightness seems to be decreasing over time, even with no change in patient or technical factors. What is the most likely cause of this degradation? A. Increased ambient light in the room. B. Degradation of the input phosphor. C. Reduction in kVp settings. D. Accumulation of scatter radiation. Answer, B. Degradation of the input phosphor. This question tests your knowledge of fluoroscopic equipment function and common issues affecting image quality over time, a practical aspect of equipment maintenance and troubleshooting. The keywords image intensifier's brightness decreasing over time with no change in patient or technical factors suggest an inherent issue with the equipment itself. The input phosphor of the image intensifier, typically made of cesium iodide, degrades with age and cumulative radiation exposure, leading to reduced efficiency in converting X-ray photons into light. This degradation directly translates to a dimmer output image, even when X-ray input remains constant. For example, an older image intensifier tube will naturally show less light output compared to a newer one, necessitating higher dose rates to achieve adequate brightness. Remember, components like the input phosphor have a lifespan and degrade with use. Question 18. A patient is referred for a plain film abdomen to rule out acute appendicitis. Given the typical presentation, which positioning projection is most crucial for visualizing free air in the peritoneal cavity, if present? A. Supine abdomen. B. Erect abdomen. C. Left lateral decubitus abdomen. D. Right lateral decubitus abdomen. Answer, B. Erect abdomen. This question assesses your understanding of optimal positioning for specific pathologies, especially for visualizing free air in the abdomen, which is critical in emergency radiography. The keyword free air in the peritoneal cavity immediately points to the need for gravity to demonstrate air. An erect abdomen projection allows free air, which is less dense than fluid or tissue, to rise and accumulate under the diaphragm, making it visible as a crescent-shaped lucency. For example, a small amount of free air may be easily missed on a supine view, but becomes evident beneath the diaphragm on an erect film. While a left lateral decubitus can also show free air, if the patient cannot stand D, the erect view is the standard initial choice for this purpose. Always remember, air rises, so an erect or decubitus position is needed to see it. Question 19. What is the main principle behind the use of a grid in diagnostic radiography? A. To reduce patient dose by absorbing primary X-rays. B. To improve image contrast by absorbing scatter radiation. C. To increase the overall brightness of the image. D. To magnify small anatomical structures. Answer, B. To improve image contrast by absorbing scatter radiation. This question tests your understanding of the fundamental purpose and function of an anti-scatter grid, a crucial component for producing high-quality radiographs. The keyword main principle asks for the primary reason grids are used. Grids are placed between the patient and the image receptor to absorb scatter radiation, which does not carry useful diagnostic information and degrades image contrast by adding unwanted fog. By removing this scatter, the grid allows more primary, image-forming photons to reach the receptor, resulting in a cleaner image with enhanced contrast. For example, a grid is essential for larger body parts like the abdomen or pelvis to prevent scatter from obscuring subtle pathology. Remember, grids are all about cleaning up the image by removing scatter, thereby improving contrast. Question 20. Which of the following accurately describes the relationship between matrix size and pixel size in a digital image, assuming a fixed field of view, FOV? A. As matrix size increases, pixel size also increases. B. As matrix size increases, pixel size decreases. C. Matrix size and pixel size are unrelated. D. Increasing matrix size improves temporal resolution. Answer, B. As matrix size increases, pixel size decreases. This question explores the fundamental concepts of digital image resolution, specifically the interplay between matrix size and pixel size, which is critical for understanding image quality. The keywords matrix size, pixel size, and fixed field of view, FOV, define the parameters. A matrix is a grid of pixels. If the overall imaging area, FOV, remains constant, increasing the number of pixels within that area, matrix size, necessarily means each individual pixel must be smaller. For example, if you have a 10 by 10 cm FOV and change from a 512 by 512 matrix to a 1024 by 1024 matrix, the physical size of each pixel decreases, leading to improved spatial resolution. Remember, for a given FOV, more pixels, larger matrix, means smaller pixels and better detail. Question 21. A patient with suspected bowel obstruction is scheduled for an abdominal series. The radiographer must prioritize image views to detect potential complications. Which view is most essential for identifying free intraperitoneal air in a patient unable to stand? A. AP supine abdomen. B. AP upright abdomen. C. Left lateral decubitus abdomen. D. Right lateral decubitus abdomen. Answer, C. Left lateral decubitus abdomen. This question tests your ability to adapt imaging techniques to patient condition, specifically for demonstrating free air when an upright position is contraindicated. The keywords free intraperitoneal air and unable to stand are crucial. For a patient who cannot stand, a left lateral decubitus view is the preferred alternative for demonstrating free air. In this position, the patient lies on their left side, allowing any free air to rise and collect between the right lateral abdominal wall and the liver, making it visible as a lucency. For example, imaging with the patient lying on their left side for 5 to 10 minutes ensures air has time to accumulate. While a supine view is standard, it won't reliably show free air, and a right lateral decubitus would obscure air over the liver by placing the liver lower. Always remember, when a patient can't stand, a left lateral decubitus is best for free air. Question 22. Which of the following is the most significant disadvantage of using automatic exposure control, AAC, devices in radiography? A. They always require precise patient positioning and centering. B. They do not compensate for patient motion during exposure. C. They primarily control KVP, leading to variable contrast. D. They are less reliable for very small or very large body parts. Answer: A. They always require precise patient positioning and centering. This question addresses the practical limitations of automatic exposure control (AAC) systems, which is important for understanding how to use them effectively and avoid errors. The keyword most significant disadvantage points to a major challenge in AEC use. AEC devices measure radiation reaching the image receptor and terminate the exposure once a predetermined density is achieved. Their accuracy relies heavily on the correct selection of activated ionization chambers and precise centering of the anatomical structure of interest over these chambers. For example, if the active chamber is not under the densest part of the anatomy, the exposure might terminate too early or too late, leading to an under- or overexposed image. Remember, AEC is fantastic, but it's only as good as your centering. Question 23. A patient is scheduled for a lumbar spine series. During the preliminary scout image review, the technologist notices that the patient's spine is significantly scoliotic. What is the most appropriate action for positioning the patient for subsequent oblique views? A. Rotate the patient an additional 10 degrees beyond the standard 45 degrees. B. Use the standard 45-degree rotation for both obliques. C. Adjust the degree of obliquity for each side to match the degree of spinal curvature. D. Perform only AP and lateral projections, omitting the obliques. Answer: C. Adjust the degree of obliquity for each side to match the degree of spinal curvature. This question tests your critical thinking and adaptability in patient positioning for specific anatomical variations, a common challenge in medical imaging. The keyword significantly scoliotic indicates an abnormal spinal curvature, which directly impacts standard positioning protocols. For scoliotic spines, the degree of obliquity for lumbar spine views must be individually adjusted for each side to open up the intervertebral foramina effectively. This means rotating the patient to align the spine as close to parallel as possible with the central ray and image receptor for the specific curvature. For example, one side might require 30 degrees of obliquity, while the other requires 50 degrees to properly visualize the pars interarticularis. Remember, for scoliosis, you must individualize oblique positioning to align with the curve. Question 24. A radiographer is using a CR system and notices a ghost image from a previous exposure appearing on the current image. What is the most likely cause of this artifact? A. The image receptor was exposed to excessive ambient light. B. Incomplete erasure of the photostimulable phosphor, PSP, plate. C. Overprocessing of the digital image in post-acquisition. D. Static electricity buildup on the image receptor. Answer: B. Incomplete erasure of the photostimulable phosphor, PSP, plate. This question focuses on a specific artifact commonly encountered in computed radiography and its underlying cause, which is crucial for troubleshooting image quality issues. The keyword ghost image from a previous exposure directly points to the persistence of a latent image on the PSP plate. If the CR reader's erasure lamp, which typically uses bright white light, does not completely remove all the stored energy from the photostimulable phosphor before the next exposure, remnants of the prior image can appear as a faint ghost on the new image. For example, if an older CR plate is used or the erasure lamps are failing, a faint outline of a previous large exposure might be visible on a subsequent smaller exposure. Always remember that complete erasure is vital to prevent ghosting in CR. Question 25. Which type of radiation is primarily responsible for the majority of the occupational dose received by a radiographer during a diagnostic X-ray examination? A. Primary radiation directly from the X-ray tube. B. Leakage radiation from the X-ray tube housing. C. Scatter radiation from the patient. D. Remnant radiation transmitted through the patient. Answer C. Scatter radiation from the patient. This question is fundamental to understanding radiation safety for healthcare professionals, focusing on the main source of occupational exposure. The keyword primarily responsible for the majority of occupational dose asks you to identify the predominant source of radiation exposure to staff. While some primary and leakage radiation exists, the vast majority of a radiographer's occupational dose comes from scatter radiation, which originates from the patient's body as the primary X-ray beam interacts with tissues. For example, during a fluoroscopy procedure, the technologist standing beside the patient is primarily exposed to scatter radiation emitted in all directions from the patient. This is why lead aprons and maintaining distance from the patient are so critical. Remember, the patient is the biggest source of scatter, so protect yourself accordingly.